Good morning. Today I'm going to be performing the nasogastric feeding for neonates. I've already prepared my equipments, and before we start, I've already explained the procedure to the parents and gained their consent. Now this allows me to gain their cooperation as well while doing the procedure. I've already washed my hands and worn my gloves to prevent contamination. And now we're ready to place our protective towel over the neonate's chest. Now this prevents her from any exposure to aspirated gastric contents later on. And the feeding position for this procedure is right side lying with the head and chest slightly elevated. Now before we aspirate the gastric contents, we have to confirm the proper placement of the catheter inside the stomach by using auscultation. Put that over there. And what we need to do is take the tube and prepare a syringe with 3 ml of air. And before inserting it, we have to clump it. Insert the injection. Now what I'm gonna do is while injecting the air, I'm also listening to the air entering the stomach. So let's do that. Okay, so I have heard the whoosh sound in the stomach while doing that. Now, however, this is not a recommended step for some, and the golden standard for checking for proper placement of tube or catheter is actually chest x-ray. Now we're ready to aspirate the contents or aspirate the tube before the feeding. Now this actually allows us to check the contents, residual contents, and also remove any air. Now I'm gonna start aspirating. If the aspirated content, gastric content, is over 1/2 of the previous feeding, then we have to withhold the feeding. We cannot return this into the stomach, do not return it into the stomach, and also we have to notify our healthcare provider for this large residual volume. Now for this, we have to discard it. So what we're gonna do, clump it to prevent air from entering the stomach of the baby. Remove the syringe and discard. Now put it back. If when aspirating, if we only aspirated a small residue of formula from the previous feeding, then we can go ahead and return it back. But what we have to do is subtract that amount to the total amount that will be given later on. We also have to record or document any residual. Now for example, I'm supposed to give 20 ml of breast milk, and I have aspirated 5 ml of gastric content. So what we're gonna do, take off the 5 from the 20, so that will give me 15 ml of breast milk that will be given later on. Now we're ready to feed our baby. Before that, we have to change our syringe, and when changing it, we have to clump it once again, preventing air from entering the stomach. Remove the syringe. Now attach the reservoir or the feeding tube and fill it with the breast milk. Now I'm doing 15 ml of breast milk because that's what I need to give today. And release. Now we also have to encourage the baby or the infant to suck on a pacifier while feeding, and also hold the infant when possible. Now the flow of the feeding should be slow. We should not put pressure on the reservoir. Do not push with plunger, or do not put your finger on top of it. And it has to be elevated at least 6 to 8 inches above the patient's head. Now the elevation of this reservoir actually allows the flow of the fluid that is aided through gravity. Now the feeding time should last for approximately 5 to 10 minutes per 5 ml, or a total time of 15 to 20 minutes. Now when the feeding is completed, what we're gonna do is we need to irrigate the catheter with clear water. Before doing that, we have to clump once again, prevent air from going in. Pour the clear water or clean water, and then release. Now before the fluid reaches the end of the catheter, we may clump once again, withhold it or withdraw it quickly, or we can keep it in place to use for the next feeding. Now remember, we have an open port still. What we can do is use a part of the tube again to kink it and insert it in that open port. Now that secures the port, preventing the air from entering the stomach. Now after that, we have to discard our reservoir or feeding tube and also any leftover solution. And we're ready to burp our baby. Now we can also stimulate the baby while burping. The patient may not burp if the air was aspirated from the tube before the feeding. Now after burping, we have to place again the baby in a right side lying position and we have to do it for an hour. Now we have to observe the baby's condition after refeeding because she might experience bradycardia or apnea, and also note for vomiting, note for the infant's activity. And lastly, we have to accurately describe and record the procedure by including the time of feeding, the type of gavage tube feeding, the type and amount of fluid given or the feeding fluid given to the baby, any residual amount or any amount that was vomited, and lastly, we have also to document how the baby tolerated the procedure before, during, and after the procedure. Lastly, we have to do aftercare and do our hand washing. That's all. Thank you.